Anyone touched by cancer knows that they're in for the battle of their life. Chemotherapy and radiation may ward off the disease, but the toll of the treatment may be too much for some to bear.
Really close to my 18th birthday. It was July 28th.
The day Serge Gasanov will never forget.
Hodgkin's lymphoma, second stage.
Gasanov underwent a month of experimental treatment in Germany, then 6 rounds of chemo in the U.S.
It did help me for some period of time, but it came back.
The future looked bleak.
He had been treated extensively at All Children's, had received chemotherapy, had a major relapse, and declined further chemotherapy.
Sarasota oncologist Dr. Stephen Mammis of Cancer Center Sarasota Manatee stepped in.
About 3.5 months ago, he was having a nearly complete obstruction of his airway, so he couldn't breathe. And this was due to compression of his windpipe or his trachea from swollen glands in his neck.
Dr. Mammis says Gasanov had really given up on any treatment for his Hodgkin's disease.
But he did allow us to treat him with a new treatment, immunotherapy. And we gave him a drug called Keytruda, which we received on a compassionate basis. And these drugs allow the tumor to become visible and allow your immune system, when the drug works, to destroy the tumor.
Keytruda, currently only FDA approved to treat lung cancer and melanoma, yields promising results.
And the reason we chose it for Hodgkin's disease is there's experimental information suggesting that Hodgkin's may be the tumor which is most sensitive to Keytruda.
Gasanov says he has a strong message.
Take any chance you have. Any chance.
Because, says Gasanov, you never know what will happen to you. And after only a few months of treatment, this is Gasanov now.
When Dr. Mammis told me about the drug, it kind of like gave me hope, like, yeah, I want to try it.
Dr. Mammis says this patient chose to be treated, and he did get treatment.
And his most recent scans, at least by PET scan criteria using radiopharmaceuticals, suggest that he's had a complete remission.
How does Gasanov feel today?
Very happy that, like Dr. Mammis said, I'm in complete remission, which is, of course, a good news to any cancer patients.
Getting back to activities.
I'm starting to live a normal life right now, getting a job, and getting back on the bike. That's what I always liked.
If your doctor thinks that you should get the drug, even if it's for use for a different cancer other than the FDA-approved one, if it's off-label as it's called, Dr. Mammis says you actually can get it.